When the honourable member, my honourable friend for North Devon, and I recently visited a hospital in Barnstaple, a surgeon there told us that it was like a ticking time bomb. He explained that a hospital that size needs 12 operating theatres to meet demand. They've got just 4. The last Conservative government promised to rebuild it, and we all know that was a hollow promise. Now the North Devon District Hospital is one of 9 across the country where their urgent rebuild programme has now been postponed for over 10 years. So will the Prime Minister meet honourable members whose constituents' lives are being harmed by this delay to see if there's any way we can bring these urgent projects forward?
As my right honourable friend said earlier, last week North Devon District Hospital got the devastating news that investment would be delayed 10 years beyond 2035. In the 5 years since the last government's empty promises, our hospital's maintenance backlog has grown to over £40 million. Given that £200 million has reportedly been spent just on consultancy fees for the new hospital programme, what funding for extra maintenance will be available for those hospitals that now face another decade of waiting?
In the gallery today are patients who use the Royal Berkshire Hospital. Parts of its estate are crumbling as we speak, and it urgently needs a rebuild, but we're going to have to wait until at least 2037. Can the Prime Minister please explain to these visitors and the House why he thinks that it is acceptable that staff and patients dodge buckets collecting rainwater from leaking roofs for another 18 years? And will he meet with them and explain it to them face to face?
In my constituency of Horsham, my local council faces a £500,000 tax bill from the rise in national insurance, and my local hospice, St Catherine's, has had to mothball a brand new ward. What message does the Prime Minister have for all the public services that are outright losers at the hands of the very tax that's supposed to save them?
Yeah.